Hi, so thanks for sticking around for this. I can tell you from personal experience, this room is pretty conducive to naps. This is my freshman year art history class was in here. My name is Brendon Haggerty. I currently work for the Oregon Health Authority, but previously I worked for Clark County Public Health, which used some of the data that Dr. Yost presented earlier. So I'm going to talk a little bit about that, and then talk a little bit about my role now at the Oregon Health Authority, where I work on climate change a lot. And really, I'm going to talk about how, what do we do about this, right? We have these findings. What are we supposed to do with it? So I'll give a little bit of context first, then talk a little bit about Clark County, then a little bit about Oregon. So by way of context, the National Association of County and City Health Officials just, I think last week or the week before, released a new survey of local health department directors. It's a nationally representative sample. About their attitudes and their readiness to act on climate change. And you can see there's a pattern in these numbers. They get lower, and that continues over the next slide, okay? So I'm just going to set you up for that. But, you know, by and large, the directors get climate change. Yeah, that's a problem. Yeah, it's probably going to have some health issues in my jurisdiction. The consensus erodes around whether people are currently experiencing harm from climate change. But when it comes to like rubber hitting the road, can my department do anything about it? There's not a lot of confidence here, right? 19% say that their department currently has expertise, and only 8% say they have the resources to do something about it. So that's where we are with local health, and certainly local health departments have struggled a lot in recent years with a lot of budget cuts. But what can they do? I want to sort of ground us for a moment in, if we take these findings to a local health jurisdiction, to a county, what could we expect them to do? What decision could we hope to inform? And so what counties can do, you know, is they have this continuum. They can tax people and use that money to fund programs, right? Like this Take the Stairs campaign. They can build stuff. They can build bike lanes. They can invest in capital projects in their communities. They can also set policies. You have the police power, right? That's health, safety, and wellness, or well-being. And that manifests itself in terms of ordinances. We have land use ordinances, building codes, those kinds of things. So I worked in Clark County, Washington, which is where Vancouver is. It's about 425,000 people in recent census. And we chose to use this data to inform the comprehensive plan update. And that's how we as the health department were going to act on this. The reason that we did that is that we considered that to be sort of the big lever, right? There are small things we can do that have sort of a smaller effect size, and these policy system and environmental changes are considered to be where we have sort of the power to really change things. It's the difference between telling someone not to eat out of the candy bowl and just taking away the candy bowl. So the Clark County Comprehensive Plan update is actually still ongoing, but a whole bunch of technical analysis goes into preparing for that. And so in 2012, we worked on a big set of technical documents that essentially explain all the ways that our built environment influences health, and laid out a bunch of policy recommendations for inclusion in the comprehensive plan. Among those was a section on climate change. And that was a big deal because the Clark County Comprehensive Plan, if you were to open the PDF and perform a word search, you know, your Control F, you could try climate, you could try global warming, you could try carbon, you could try emissions. There's nothing. And that's important because this is the big kahuna of policy in the county. This is it. This is the guiding document from which many, many other things flow. So having zero mention was a little bit concerning, especially because many of the things, the potential solutions that we could hope for climate change are important for a lot of other reasons, and certainly for health. And so we took the data, we worked with Tanya Bush-Isaacson and took the data that Dr. Yost presented, and we were fortunate to have help from the Northwest Center for Public Health Practice in packaging that up, making it digestible for some of our policymakers. And we pitched it to them along with a lot of other things. And this is important because we're talking about three guys, basically, 3 county commissioners, and we needed 2 of them to say yeah. And one of them had already told us that he doesn't really, that climate change thing is not really, he's a denier. So we needed these other 2 to buy in. So that packaging it and presenting it was really important. I think a big part of that is that we're pointing to effects that we've already observed, right? We're just looking at historical data. We don't have to worry about the justifying a model thing. But we packaged this in. We said, look, it's going to get hotter. When it gets hot, people die. And I think a really pragmatic approach for that would be something like, okay, so like in another mass casualty event, we would rely on a neighboring county to, accept some bodies into their morgue because we would be overwhelmed, right? And we couldn't do that in a heat wave because the next county over would also be experiencing that. So what do? We have to maybe expand, or maybe we change our building code so that we have passive cooling, or we subsidize air conditioning units or whatever. That would be like a really pragmatic thing. But like I said, we were going from a zero mention in the whole comprehensive plan. So what we got was all 3 votes yes to adopt this Growing Healthier report that had a range of policy recommendations in it. And among them were these 4 that basically, these are kind of what I think of as a plan-to-plan policy. Like we're just going to say, well, we'll work on it. We promise we'll work on it. But that's a big deal because that all of a sudden, that big kahuna policy document is incorporating this stuff. And so the way that we used the data was a foot in the door, essentially, to get climate change considered by a foundational policy document. And that carries over, because my boss at the time was John Weisman, who's now the Secretary of Health for Washington State, and you'll hear about more what they're working on. But at the time, he wrote this fairly heartfelt column in a sort of I guess it's an industry publication. It's the Association of County and City Health Officials. He was the president at the time, and he wrote, "I was a reluctant leader on climate change. We went through this process. It's really important. We all need to be working on it now." And now he's the Secretary of Health. So this has ripple effects is my point here. I think there's some bad news there, though, for Clark County, in that John's left, I've left, a lot of the policymakers have turned over. The work is so far from done, but it's started. And now I'm going to talk a little bit about what I'm working on in Oregon, and I'm going to relate it to some national efforts. So the Centers for Disease Control and Prevention has a climate and health program. They fund states and cities. Let's see, these are they, to work on climate change adaptation. We worked with 5 local health jurisdictions in the state of Oregon to prepare a local climate and health adaptation plan for their jurisdiction. You can see that in the north central Oregon is that's all one health district. They played together, and this represents a diversity of environments and both in terms of the development intensity, the natural environment, and the political context across Oregon. You have Central Oregon, which is really quite rural, as well as North Central. That's Benton County there on the central west side where Corvallis is and Oregon State University. We have Multnomah County, which is home to Portland. And down at the southern border, we have Jackson County where Medford is. Each of them developed a climate and health adaptation plan using this BRACE framework. The BRACE framework is not unlike any other policy analysis framework. You have this phase where you're quantifying and defining the problem, identifying some solutions, picking one, implementing it, evaluating, doing the whole thing again. They all went through that process. They focused on these 5 statewide risks to human health. And I think this represents a bit of a dated perspective. We're updating this currently. And these integrate heat threats in different ways. But I want to focus on how those counties used climate data. They used it to talk about baseline conditions, and at the local level, they really basically didn't have the capacity to project. They talked about the direction of change, like it's going to get worse. They didn't talk about the magnitude, how much it's going to get worse. They translated that into policy actions or program actions or proposals that are really geared more toward education and outreach, which is really important. But we're missing sort of those bigger levers like we talked about earlier, the policy systems and environmental changes. And a lot of those proposals are based on sort of best practices or basically some good ideas, not, let's say, the equivalent of a randomized clinical trial. So the point here is that we have more need for more detailed data. And I think that we're good at quantifying baseline conditions and describing some relationships. And this map that you see is an example of that, of mapping a heat index or urban heat island effect in Portland. Not so good at projecting into the future. And as part of the BRACE framework, which is being deployed nationwide, a core step of that is projecting the burden of disease under various scenarios in the future. And that is a task that is pretty tough. And we need not just data, but we need methods to be developed for doing that. So those of you in the room who can help with that, I'll be here with a big stack of business cards at the end. Thanks.